want to talk to you guys about drains versus no drains on tummy tucks. Now, before I get into this debate, I want to make one point very clear. Whenever I'm talking about a technique or a technology or anything related to how a procedure is done, it should never outweigh what is the most important part is, what are the results? Because fundamentally, the result is the thing that matters most. Not how you get there, but that you can get there. Now let's get into it. A lot of this conversation happening on social media, one person saying why you should use this technique and why mine's better tthan this person's. Some of these are my friends and colleagues, so I thought I would jump into the mix here. Now, a little bit of background. Traditionally, we use drains in tummy tuck surgeries to prevent a complication called a seroma. A seroma is a little fluid collection. It's not blood or pus, it's just regular fluid that your body can collect in a space. And drains were intended to limit the risk of that happening. Now, the good news is when you get a seroma, this is not a devastating complication. It's readily treated in clinic just by drainage. It's pretty painless. It will always go away and it should not compromise your result as long as your provider stays on top of things. Now, the argument that surgeons in the drainless tummy tuck camp use is number one, they have a decreased risk of seroma. Well, studies have shown that's actually accurate. Drainless tummy tucks have at or lower rates of seroma than those patients who have drains in their tummy tucks. The second is that in the drainless tummy tuck group, they say that there's less pain and discomfort after surgery. And yes, this is probably true. During that first week when a patient has drains, there may be some discomfort in having those. However, that pain goes away as soon as the drains are removed. Now, let me tell you why I don't agree with these arguments and why I use drains in my tummy tucks. Now, let me first address their argument. Number one, seroma. Yes, there may be a slightly increased risk of seroma even when you use drains, but that incidence is still less than 5%. It's very easily treated, and it never, almost never, leads to any sequelae related to your result. Number two, the pain and discomfort. Yes, there is some pain and discomfort that can be associated with the drains the first week. However, once the drains are out, that pain and discomfort is gone. So you're talking about worrying about discomfort in the first few days of your surgery for a result that you're going to have for decades of your life. If you're worried a little bit about that, I think you might be missing the forest for the trees. But the most important argument I make for this is it has to do with results, because at the end of the day, this is about results. And when you have these procedures, we're doing liposuction, we inject a lot of fluid into the space, you're gonna have swelling, there's gonna be an accumulation of a lot of fluid. If you don't leave drains, that's 1 to 2 liters of fluid your body has to deal with. In my experience, the results are not as dramatic. You lose the ability to have greater contours, you lose the ability to have a smaller waistline, and you lose the ability to shape as effectively as you do when you have drains in place to remove some of that fluid. Because at the end of the day, it's about results.